Hello everyone, it's Dr. Rafael Gutierrez. Welcome to my channel. For those of you who have seen me for a while, thank you for coming back. For those of you who are looking at this because you're looking at the title and you thought, what is this? My channel is usually a little different. I am a professor. I teach anatomy, physiology, microbiology. I have taught clinical anatomy. I've actually even taught pharmacology quite a few times. And I did earn an MD 25 years ago. And what I'm actually going to talk about today is a little different, like I said. What happened is this. Recently I read about the fact that a medication that's used as an anti-cancer treatment, actually in some cases it's the drug of choice for certain types of cancer. It's also a medication that's used as an immunosuppressant when people have rheumatoid arthritis, rheumatoid diseases, autoimmune diseases. And for certain conditions that are autoimmune, meaning the body attacks itself, it is one of the better drugs to use. It has been on the market for over 20 years. And out of the blue, without really looking at the medical facts, a judge decided that it should be taken off the market. Now, right now there are different things that are going through, but people don't understand how medicine works. If you watch this before, you know that I talk about, your standard deviation curve. The average person is average, meaning if you go and talk to 10 people, the level that half of them would be at is average. They don't necessarily understand medication. If you think about it, if I mention most medications to people here, they won't know what they do because it's not their responsibility to know that. There are medical professionals who know what medications are because a lot of them use that. But a judge can actually make a decision whether he has any medical expertise or not and take it off, and people will celebrate it. Oh, he's getting medications off the, they won't say medications. He's getting drugs off the market. We don't need drugs. If you happen to have cancer and you're on this, well, tough shit, I guess, because nobody really cares about someone who has cancer or someone who's immunocompromised. It doesn't matter. It doesn't make news, does it? Seriously, think about it. Unless a celebrity gets something, it really doesn't make any news. Pretty much, unless you're rich and famous, nobody cares. And that's actually one of the big problems. Most people are actually looking for these big stories. And, this medication over here was taken off because it agrees with my religious views. But this one over here, by getting rid of it, a couple people will die, but hey, you know what? Don't care because it doesn't affect me. It's not someone famous. It's not someone I watch on TV. It's not a multi-billionaire. And the problem is, it doesn't matter to most people until they have a family member who has an autoimmune disease. It doesn't matter to anyone until a family member has cancer. And so what does it matter if a judge with absolutely no medical experience whatsoever bans a medication that is useful for thousands of different conditions? Doesn't matter, right? I mean, hey, it's not affecting, if you don't have this, it's not affecting you. And if it's not one of your family members, you can wait until your family member has that and then you'll worry about that, right? For those of you who don't know, there is a medication. Like I said, it's going to be heard by the Supreme Court soon, which was actually removed off the market after being on the market for over 20 years. It has been used. They've actually shown that data, people who have taken it, who are taking it, it has pretty much less harmful effects than a lot of medications that are sold over the counter. And if you're watching this and wondering why you haven't heard of it, I can guarantee you have. The problem is, the way medications are is usually they don't work for one condition. They work for multiple things. And so you can't have medications who work for if someone had a miscarriage, if someone has cancer, if someone has an autoimmune disease, if someone has IBS, if someone has Crohn's disease. A lot of these conditions actually can be treated with certain types of medication which function. And if you're over, let's say 45 and you're on medication, you may have actually realized that there are some medications that they give you and they may not work for you, even if they are the best medications out there. It's the most expensive and latest. But if it doesn't work for you, it doesn't matter, does it? And so the thing is, when people are actually dealing with medicine, they really have to look at what the experts are saying. What are people saying about certain medications? It's not just a way, well, I don't understand the medication and someone told me it does this, so I'm jumping to that. If you haven't noticed yet, the medication I am actually talking about, and I ask you to Google it, go to a pharmaceutical website and Google how methotrexate is used for thousands of conditions and how many patients benefit from having access to this medication. And then ask yourself, is it worth getting this medication away from people who it may be saving their life? It may be actually allowing them to have a decent life without their body completely destroying themselves from the inside. Pretty much a horrible symptoms, literally eating you from the inside out. And then when you actually do that, then go ahead and look at the other things it could be used for. That's fine. But remember, it's not only used for one thing, it's multiple things. And so when a judge from Texas decides, hey, you know what? I'm going to decide what medications should or shouldn't be available, even though it has 20 years experience, is that really something ethical? And I would ask you this, if you're not furious at the fact that someone with absolutely no medical experience, probably hasn't even taken a general biology class in high school, can decide what medications a doctor could prescribe, even if they work for things that may be terminal, may be so destructive to your body that you can't even go outside the door. If that isn't something that you're thinking, wait, this is wrong, ask yourself why. And ask yourself, if this is a medication that your family member needs for any reason, let's say we're going to stick with an autoimmune disease or cancer or IBS. If this is a medication that would have helped your family members live a better life, should it have been taken off? I hope you got something out of this video. I hope that you can actually see why I decided to say something about this rather than what I usually do. And I hope you understand, again, that average is average. And some people are really good at one thing. For instance, a doctor can tell you a lot of things about how medications are work. A pharmacist can also tell you that. But when it comes to legal issues, they're going to go to an expert, like a lawyer or a judge. They're not going to try to say, well, I'm an MD, and so I know the law better than a lawyer. They're going to actually go to that area. If you think about it, in medicine, most doctors actually specialize in something, and that's where they actually do their work. If something goes beyond what their level of expertise, they refer out. Why are judges now deciding that they know more about the human body than someone who spent 4 to 5 years in an undergraduate, another 4 years of medical school, another year of internship, another few years of residencies, maybe even a fellowship, and then who knows how many years training? How is it that this judge, which I'm not even going to try to say his name because he's a piece, how is it that a judge with absolutely no medical knowledge whatsoever is making decisions that are affecting the entire nation and their family members, people they know who may actually be suffering from conditions because, well, it's a political thing. And if you don't think it's a political thing, well, I don't know what to say.